Hi, and thank you for watching this video on the dangers of untreated hypertension, also known as high blood pressure, presented by Pecos County EMS. All information in this presentation was obtained from the mayoclinic.org. It's a really good website and a good place for information, and I encourage everybody to go there and read some articles. Before we begin, a little bit about me. My name is Abel Galindo. I'm a paramedic here with Pecos County EMS. I'm also a nationally registered paramedic and certified flight paramedic. Here at the EMS, I'm a captain and training officer. I'm also an aspiring skydiver. Haven't done it yet, just thinking about it, and I'd appreciate it if you didn't rush me. Thanks. Okay, so getting into it, there's lots of consequences of untreated hypertension or high blood pressure. Untreated hypertension can lead to many disorders all over your body. Most of them have a very significant impact on people's lives and even lead to death. If you've been diagnosed with hypertension and you aren't sure about it, then this video is for you. Also, if you have a friend or family member that's been diagnosed with hypertension and they aren't taking care of it, please share this video with them to shed some light on what it means for their body. So let's break it down system by system. Effects on your vascular system. Healthy arteries are flexible, strong, and elastic. Their inner lining is smooth so that blood flows freely, supplying vital organs and tissues with nutrients and oxygen. Hypertension, what it does, it actually increases the pressure of the blood flowing through your arteries, and as a result, you may experience damaged or narrow arteries. High blood pressure can damage the cells of your artery's inner lining, making them jagged. So whenever fats from your diet enter your bloodstream, they can collect on the damaged arteries. Eventually, your artery wall becomes less elastic, limiting blood flow throughout your body. Also, you can develop an aneurysm. Over time, the constant pressure of blood moving through a weakened artery can cause a section of the wall to enlarge and form a bulge, which is an aneurysm. An aneurysm can potentially rupture and cause life-threatening internal bleeding. Aneurysms can form in any artery throughout your body, but they're most common in your body's largest artery, which is your aorta. High blood pressure effects on your heart. So your heart pumps blood to your entire body. Uncontrolled high blood pressure can damage your heart in a number of ways, including coronary artery disease. This is whenever the arteries that supply your blood to the heart muscle are narrowed and don't allow blood to flow freely through your arteries. When blood can't flow to your heart, you can experience things like chest pain, heart attack, or irregular heart rhythms, also known as arrhythmias. You can also have an enlarged left heart. So high blood pressure makes your heart work harder than it needs to pump blood to the rest of your body. This causes the muscle in your left ventricle to thicken or stiffen, also known as left ventricular hypertrophy. These changes limit the amount of blood that your ventricle is able to pump through the rest of your body. So this condition increases your risk for heart attack, heart failure, or a sudden cardiac death. Speaking of heart failure, over time, the strain on your heart caused by high blood pressure can cause your heart muscles to weaken and work less effectively. Eventually, your overwhelmed heart simply begins to wear out and fail. Damage from heart attacks also adds to this problem. Effects of hypertension on your brain. So just like your heart, your brain depends on a nourishing blood supply to work properly and to survive. But high blood pressure can cause several problems, to include transient ischemic attacks, or TAIs, also sometimes called mini strokes. What these are brief temporary disruptions of blood supply to your brain. It's often caused by atherosclerosis, which is like those fatty deposits we talked about earlier, or a blood clot, both of which can arise from high blood pressure. A transient ischemic attack is often a warning that you're at risk for a full-blown stroke. Speaking of strokes, a stroke occurs when part of your brain is deprived of oxygen and nutrients, causing brain cells to die. Uncontrolled high blood pressure can lead to stroke by damaging and weakening your brain's blood vessels, causing them to narrow, rupture, or leak. High blood pressure can also cause blood clots to form in the arteries leading to your brain, blocking blood flow and potentially causing a stroke. Uncontrolled hypertension can also cause dementia. Dementia is a brain disease resulting in problems with thinking, speaking, reasoning, memory, vision, and movement. There are a number of causes of dementia. One cause, vascular dementia, can result from narrowing and blocking of the arteries that supply blood to the brain. It can also result from strokes caused by an interruption of blood flow to the brain. In either case, high blood pressure may be the culprit. Effects of uncontrolled hypertension on your kidneys. So your kidneys filter excess fluid and waste from your blood, a process that depends very heavily on healthy blood vessels. High blood pressure can injure both the vessels in and leading to your kidneys, causing several types of kidney disease. Having diabetes in addition to high blood pressure can also worsen the damage. You can develop kidney failure. So high blood pressure is one of the most common causes of kidney failure. That's because it can damage both large arteries leading to your kidneys and the tiny blood vessels within your kidneys. Damage to either one makes it so that your kidneys can't effectively filter waste from your blood. As a result, dangerous levels of fluid and waste can accumulate. You may ultimately require dialysis or even a kidney transplant. You can also develop kidney scarring. So scarring occurs when the tiny clusters of blood vessels in your kidneys that filter the fluid and waste from your blood, they're unable to filter the waste effectively, leading to kidney failure. You can also have a kidney artery aneurysm. An aneurysm, like we discussed earlier, is a bulge in the wall of a blood vessels. When it occurs in an artery leading to the kidney, it's known as a kidney or renal artery aneurysm. One potential cause is atherosclerosis, which weakens and damages the artery wall. That's the accumulation of plaque on the artery wall. Over time, high blood pressure and a weakened artery can cause a section of the artery to enlarge and form a bulge, the aneurysm. Aneurysms can rupture and cause life-threatening internal bleeding. Uncontrolled high blood pressure can also affect your vision. Tiny, delicate blood vessels supply blood to your eyes. Like other vessels, they too can be damaged by high blood pressure. Eye blood vessel damage. High blood pressure can damage the vessels supplying blood to your retina, causing retinopathy. This condition can lead to bleeding in the eye, blurred vision, and complete loss of vision. If you also have diabetes and high blood pressure, you're at even greater risk. Fluid buildup under the retina. In this condition, fluids build up under your retina because of a leaky blood vessel and a layer of blood vessels located under the retina. This can result in distorted vision or in some cases scarring that permanently impairs your vision. Nerve damage. This is a condition which blocked blood flow damages the optic nerve. It can kill nerve cells in your eyes, which may cause bleeding within your eye or vision loss. So when does hypertension become an emergency, or when should you call 911? High blood pressure is usually a chronic condition that gradually causes damages over the years, but sometimes blood pressure can rise so quickly and so severely that it becomes a medical emergency, requiring immediate treatment, often with hospitalization. In these situations, high blood pressure can cause the following: memory loss, personality changes, trouble concentrating, irritability or progressive loss of consciousness, stroke, severe damage to your body's main artery or an aortic dissection, chest pain, heart attack, sudden impaired pumping of the heart, leading to fluid backup in the lungs, resulting in shortness of breath, or pulmonary edema, which is fluid in the lungs, sudden loss of kidney functions, complications in pregnant women, such as preeclampsia or eclampsia. These and a few other signs and symptoms are good reasons to call an ambulance. Our paramedics here at Pecos County EMS and also our advanced EMTs are equipped to help lower your blood pressure if deemed medically necessary. So let's say you do have high blood pressure. Is it too late for you? Probably not. Here's some tips on treating and taking care of your high blood pressure. So you can lose a few extra pounds and watch your waistline. Exercise regularly for cardiovascular health. Eat a healthy diet. Reduce the amount of sodium or salt in your diet. Limit the amount of alcohol that you drink. Quit smoking. Cut back on caffeine. Reduce your stress level, easier said than done, I'm aware. And monitor your blood pressure at home and see your doctor regularly. Number 10, again, see your doctor and take your meds. Just because you're taking medication for high blood pressure and you don't have high blood pressure while you're taking your medication doesn't mean that you don't have high blood pressure anymore. Your high blood pressure is being controlled with medication, and that's great. So if you're taking your meds and you're also doing all these other things, and maybe your high blood pressure is controlled naturally, then go back to your doctor and talk to them and have them reassess. Maybe they can lower your prescription doses, maybe they can take you off, but never take yourself off of high blood pressure medicine. That's where we see a lot of the problems where we have a patient as far as EMS goes, patients that wing themselves off of their medications. Please don't do that. Okay, so that concludes our presentation on the effects of uncontrolled hypertension or high blood pressure on the human body. Thank you again for watching these videos, and if you have any questions, our contact information is on the screen. Have a great day.